My name is Jason Whitehead, and I'm the CEO of Tritons, and we are sponsoring this speaker series, and we're very excited to have Emily Richards from Sade Wellness here today. Just a quick little shout out about our program, which you probably saw when you registered on our website. We're doing a monthly speaker series trying to address a variety of topics of interest to HR professionals, IT professionals, and just really helping organizations figure out how they can make their businesses more successful. We're very excited to be able to offer these on a monthly basis right now, and we do it the second Thursday of every month. We have a live in-person presentation down at the Robert Half Technology offices in Washington, D.C. So if you are local and you'd like to come join us for future presentations, we'd love to see you. We've had some pretty good groups and good discussions. And then we do these webinars a week later on the third Thursday of every month, and these webinars will be recorded, and the slides will be available for download in just a few days. So if you're interested in getting a copy of the information, you can either email Emily directly, or you'll be able to download it from our website, tritons.com, shortly. So with that said, I'm very excited to have Emily. She is a leading expert in workplace wellness programs. Her company, and she'll tell you about it in just a little bit, has done some wonderful things to really help improve the health and wellness of employees and associates with a variety of companies in the area. And she's got some really great success records helping with drive the business bottom line as well. So with that said, Emily, if you'd like to take it away, that'd be great. But before we do, I do ask that if everyone on the phone could just mute their audio, and if you have questions or things that you would like to share, if you can just chat them to me, and at the end, I'll collect all the questions and go through, and we'll go from there. Okay, so thank you very much, and Emily, take it away.
Great, Jason. Thank you so much, and thank you everyone for attending today. I hope that at the end of this that you'll learn something new about the importance of workplace wellness, and if not, then I hope that you send a chat question over so that I can ensure that you walk away with some negative information that you can either implement within your own corporation or use in some beneficial way to furthering the mission of workplace wellness. But I wanted to start off, again, as Jason said, my name is Emily Richards, and I own Sade Wellness. We provide a comprehensive workplace wellness solution, to which I'll get to in a minute. And the premise of what we're doing today is a business case for workplace wellness programs. Basically, why workplace wellness program is not only needed but necessary in a business environment today. So we'll just begin with what is all the buzz about. So these terms that I've put on the screen, they're probably terms that you've heard either in the workplace, on the news. There's definitely a buzz around the importance of health and nutrition and fitness, and then there's also some of the negativity that's associated with being unhealthy, such as obesity, absenteeism, presenteeism. For those of you who are unfamiliar with presenteeism, presenteeism is simply the state of being at an office at your desk and being present but not being fully engaged. So, for instance, an example that we like to use is if there's someone who is caring for the elderly parent who's ill. They're attending work every day, but they might get distracted by a phone call from the assisted care facility, or they might be burdened by not knowing how they're going to pay for expenses later on in the month. And so it's being present but not being fully engaged. And then biometric screening, which actually all of these terms we will address in some way or the other, but they're definitely buzzwords that have started to gain traction both in the mainstream media and obviously where there is importance in the workplace. Wellness defined. Wellness can mean many things, but I think World Health Organization has created a very good terminology for this word. And they define it, wellness, as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And that's really critical. I think a lot of times people make the assumption that wellness is just about being fit, being within a healthy BMI range, eating healthfully, but at the end of the day, it really does come down to much, much more, including your mental, emotional, and spiritual well-being. So a little bit of introduction. I told you who I am, but what we do, who we are first. We are a corporate wellness solutions firm, and what we do is provide turnkey, seamless, comprehensive programming to companies. So basically, we come in and can provide the soup to nuts offering to ensure that they have a comprehensive wellness program. A lot of companies that we go into, we find, are doing some element of wellness. They are doing a Weight Watchers group here, or they are doing some form of lunch and learn on a sporadic basis, but there's no continuity that is bringing their wellness program together. And through our programming and through the use of our virtual tools, we're able to create a very comprehensive, seamless offering. And that's basically how we do it. Our focus is on the virtualization of all of our offerings, and we place significant focus on the metrics and engagement. We are finding that with companies, it's very difficult to be able to prove our worth to the CFO unless we are able to show measurable metrics that directly correlate to a savings to their bottom line. And so we are a metrics-driven company. We can't get the metrics that we want to prove our case to the CFO if there is an engagement. So we ensure that we have a significant level of engagement for the types of programming that we offer as well as how we implement them. You as whatever company you are part of, you may already have an existing wellness program, or your company might not have any form of program in place. Wellness is still a relatively new concept in many firms. In other firms, it has been established for some time, particularly in larger firms that not only understand but see the significant positive impact to the company's bottom line. And at the end of the day, that really is where we see clients coming back to us who have seen the proven return on investment to their bottom line. And how we do it is we align ourselves with the Healthy Workforce Act. For those of you who are familiar, the Healthy Workforce Act has 4 key components that they attribute to a successful wellness program. They include education, they include rewards and incentives, they include behavioral modifications, which is like activities, and the 4th element is biometric screening and health risk assessments. And so we ensure that we incorporate all 4 of those key components into the program that we put into companies. And we make recommendations for any company that's looking to implement a program to ensure that they have those 4 key elements as well. I touched on a bit earlier on how we do what we do, and I spoke to engagement. But engagement, again, I want to highlight that as a critical key component. And that is why we have partnered with TriTons, because we have understood that the importance of engagement within our virtual platform as well as one-on-one personal, in-person engagement is critical as well. And I actually want to turn it over to Jason for just a moment so he can speak a little bit more on the engagement piece before we go forward.
Great. Thanks, Emily. So with TriTons, we're excited to work with Sade Wellness because they have such a great program and tool set and tremendous subject matter expertise in the wellness piece. What TriTons does is really focus on the business and the engagement side. And we say, how do we translate that into employees actually adopting their wellness tools and techniques that are available to them? And then also, how does the organization manage work and focus on their policies and processes and things to make sure that they get a return on investment they need from their wellness investment? So, for example, when you're putting together a wellness program, there's a whole bunch of business policy decisions that you need to make, such as, do we want to make it mandatory for people or optional? If you participate and achieve certain results, do we, give you cash bonuses, or do we, subsidize your premiums or do other things, or do we make a policy that you must participate in certain screening things in order to be eligible for other benefits? So there's a whole business side of a wellness program that needs to be considered and managed. And then this also translates down into things like, have we communicated effectively with managers and leaders to let them know that they need to incorporate wellness initiatives into all parts of their working practices? So maybe it's they give employees time over lunch to go to the gym, or they encourage people to do what I call a mobile meeting, which is taking a notebook and walking around while you're discussing work-type issues. So we help identify those issues, help customers go through it, and then help give them the tools and support they need to actually go through and execute, so that they get the wellness benefits and impact that Emily's team can provide.
Great.
Emily,
thank you, Jason.
You got it.
All right, great. Thank you. So this is something, an exercise that we conducted last week in the seminar, and it's a little bit more effective or impactful when you see it in person. But nonetheless, we asked the question of how many teaspoons an individual thought would go into a 12-ounce can of soda. And CNN stole our thunder because the day before they had actually made that announcement on their news show. But the answer is that 12 teaspoons of sugar go into a 12-ounce can of soda. That's pretty astonishing if you actually think about it. And if you say, oh, that's not a ton, then I challenge you to go and find a spoon and scoop 12 scoops of sugar into a cup and see what you think then. This exercise was shown within the seminar, and it was also shown. It also is often shown in our clients, and helping individuals understand very basic principles with regard to fitness and nutrition. Going back to the Healthy Workforce Act for a minute, we found that, quite frankly, the knowledge or lack of knowledge and lack of education surrounding very fundamental health and wellness principles are lacking in the corporate world. And so we have found that coming in and creating very simple programming, very simple concepts actually make a significant difference in the lives of the employees that are participating in our program. And so this was just a visual to show you some of the simple ways that we communicate health and wellness.
Emily, actually, that was a very powerful exercise, and I had people comment after the demonstration about how much they didn't realize that the sugar was involved in the soda. Just a little side note, I went out that night with a bunch of friends, and having gave up alcohol during the month of January, and then I was telling them about this exercise and visually watching you scoop out all of this sugar and see the big pile and mound there. So now I was like, great, now I don't want to drink soda either. So it really did have an impact.
Well, I'm glad it made impact. Thank you, Jason.
Okay.
All right, so what exactly is the current state of wellness? I want to walk you through several slides that have some pretty staggering statistics. First of all, we really are dealing with a costly epidemic. If Americans quit smoking, ate healthily, and exercise, 80% of diabetes, 40% of cancer, and 80% of heart disease and stroke could be prevented. That equates to 75% of all disease being preventable. If we continue down the path that we're currently going, we're going to see over $4 trillion spent in health care costs by 2020. Of course, that's an estimate, but it's growing. It's rising incredibly rapidly. And the scarier thought is that a company's healthcare costs equal 60% of their after-tax profits. So a significant amount of healthcare-related costs are directly impacting a company's bottom line. A few more statistics about the health in America. Healthcare spending.
This thing started at 11. There were 6 people on the call. Oh. Because evidently it started at 11.
Hello?
I'm sorry, if someone could mute their phone, that would be very helpful. Great, thank you. Thanks.
Okay, so going back to health in America, healthcare spending has hit an unprecedented 17.6% of GDP in 2009. And again, you can see the statistics that I spoke about in the earlier slide. And more than half of Americans live with a chronic disease attributed to unhealthy lifestyle. And those unhealthy lifestyles can include stress, physical inactivity, and depression. And one of the things that I want to highlight is the stress. The stress is a sleeper issue, but because many people can hide it, and sometimes they can't. But stress is a detrimental effect on the physical well-being of an individual long term. And then over $105 billion have been lost in direct costs due to missed work days, and $300 billion have been lost due to job stress each year. Again, many employers are unaware of the linkage between health and productivity. There are 2 types of costs related to healthcare: the indirect costs and the direct costs. The indirect costs, such as absenteeism, disability, and reduced work output, they are much harder to quantify. but they can be significantly more than direct medical costs. Productivity losses related to personal and family health problems cost the U.S. employers $1,685 per employee per year, and that equates to $225.8 billion annually. So while it's hard to quantify, it is an incredible number that companies should be looking at. Employees may be at work, but due to health concerns, they may not be working optimally, which is back to the definition of presenteeism that I spoke about at the beginning of the slide. Annual cost to companies is $180 billion per year, and the per employee cost is between $22 and $157 annually. And again, it's a very persistent problem. So what are the answers? 80% of large companies now offer some form of wellness to employees. On average, the medical costs decrease from $3.27, and absenteeism cost decreases on average $2.73 for every dollar spent on wellness programs. So you can expect between a $5 to $10 return on investment for every dollar invested into a wellness program. So as I mentioned earlier, some of the larger companies that already have existing wellness programs, such as Johnson & Johnson, they estimate that they save hundreds of millions of dollars each year, over the course of a period of years, thanks to their wellness programs. And MD Anderson, for example, they have seen a savings of over $1.5 million, and workman's compensation insurance premiums have decreased. And I'll talk a little bit about workman's compensation premiums a bit later in the slideshow, because it does play a critical role. The health of an individual that has a workman's compensation claim directly impacts the cost of the claim. So what are the positive outcomes for having a wellness program? For employers, it's lower health care and disability costs. Going back to the fact that the stat that employers spend 60% of their after-tax profits on health care spending. It enhances employee productivity. It reduces employee absenteeism. It decreases the rate of illness and injury, and decreases workman's compensation claims. For obvious reasons, workman's compensation claims, when an individual is healthier, they're less likely to be hurt on the job. Wellness programs improve employee morale. They improve employee recruitment and retention. We are finding that individuals that are coming out of college now, they're focused less on the corner office and the six-figure salary, at least some of them are, and they're now more focused on what is the company going to do and give back to me. They are more socially aware. They are more focused on the work-life balance. They are of the generation where they saw both parents working, and they want a different type of lifestyle. And so they're actually asking these types of questions of what types of giving back programs do you have? What type of wellness programs do you have to ensure that I have that life balance that I want? And one of the last outcomes for employees is the increased organizational commitment and creation of a culture of health. And the culture is so very important. If you have a toxic culture and you put healthy employees, you create healthy employees and put them back into the toxic culture, it's going to have diminishing returns. So it's very important to ensure that the culture of your organization also is healthy, so that it can breed and further the health of your employees. So what are the positive outcomes for employees? Well, it obviously increases their well-being and their self-image and self-esteem. It improves their coping skills with stress and other ancillary factors affecting their health. Again, going back to culture, it creates a safer, more supportive environment. It lowers costs of acute health issues. It lowers out-of-pocket costs for health care services. And it increases the access to health promotion resources and social support, and job satisfaction.
Hey, Emily?
Yes.
During the in-person discussion, there was a lot of presentation. There was a lot of discussion around this point, and one of the key things that I remember came out of it was the idea that all those benefits are great, but they really only happen if people adopt the wellness program and it's used well. So, that comes back to the engagement piece. One of the questions that when Tritons is working with clients, we always say, all these forecasted ROI and value that you expect to get from it, that assumes 100% adoption of either your software tool or your program or whatever you're implementing. What does your ROI look like if you adjust it for different levels of participation? And I would encourage everyone on the call that as they start to think about that, one of the key critical issues that they'll want to identify when implementing their own program is how does this affect our ROI if we don't get people to actually use it and adopt it, or if we get low levels of adoption. And some of the things that we've been seeing is that other wellness programs out there are much more passive and don't engage people, and they may be more of a poster campaign or optional services, but they don't get the same level of adoption, so they don't get the same return. So it's a critical piece.
Yeah, yes, definitely, and I'm going to get to that in a little while about the one size doesn't fit most when it comes to engagement. So absolutely. Great, okay. Thank you. All right, so understanding insurance claims, oftentimes this is the elephant in the room. There are a lot of companies that have absolutely no idea what their claims costs are. We go into a company, we'll ask them what their claims costs were over the course of the last 5 years, and they have absolutely no idea. So I pose the question back to you. Do you know the numbers for your company? And that includes prescription drug claims, workers' compensation claims, doctor's visits, hospital stays, ancillary services. And the claims analytics add an extra dimension to our ability to better understand, to see what's been spent, to forecast what you're going to spend in the future, and then also allows us to then set parameters and goals for us to help achieve through implementing our wellness programs. For you, the employer, it helps you also identify the highest paid claims areas. So, for instance, if you see the aggregated claims and you see that a significant amount of spending, let's say 50% was spent on cardiac services, then there is potentially you can reason to bet that there's a significant amount of heart disease or heart issues within your firm, and then you would need to create and tailor a program to specifically address those needs. I mentioned this a little bit before, but again, there are two types of costs when understanding the cost of unhealthy employees, and they are the direct costs and the indirect costs. The direct costs are easy to quantify. The indirect costs, such as productivity and presenteeism and absenteeism, sometimes are much more difficult to quantify, but they are a significant impact to your bottom line, so you have to know how to get your arms around them. Let's talk about the direct costs to you. The top 5 chronic diseases that have been identified by the CDC include arthritis, diabetes, stroke, cancer, and heart disease. You can see that the dollars associated next to each line item is the amount that it costs for each individual that has this disease per year. So it's an annualized basis. While those are the top 5 chronic diseases, there are other common conditions that have great impact to the company's bottom line. They include smoking, which is 100% preventable, depression, obesity, and stress. One of the things that I want to note with regard to obesity, when I was talking about the workman's compensation claims earlier, if an individual is hurt on the job and has a BMI that qualifies them as being obese, that is when their claims costs jump from the $1,000 to $2,000 range to upwards of $55,000 on average, $55,000 on average. So this is a huge, huge impact. So if you are a company that has blue-collar workers, this is certainly an area of focus that you want to zone in on to see if there are areas of improvement and strengthening your blue-collar employees to ensure that you prevent these workman's compensation claims. And then there's some information with BMI on the slide as well. And again, the higher the BMI, the higher the cost to the company. And you can see the average as the BMI rises, as the cost do. So why should an organization care? Well, you can see a breakdown. What we have taken is we have taken the general statistics for the top 5 diseases and layered it on for you to see how many, on average, % of employees are most likely affected by each of these correlating diseases. And then you can also see, as I mentioned, that obesity, we pulled obesity out because this is a rising epidemic. And while obesity is a costly and rising epidemic, it also is incredibly preventable and manageable with proper diet, exercise, and nutrition. When we're going into companies and they don't know or they can't access their claims costs, it's very difficult for us to find a starting point. So what we like to do is go in and we have a cost of waiting calculator. And so if they're on the fence and they're not certain of whether or not they're ready to implement a program, we go in with a cost calculator and we take, like from what you saw before, the top 5 chronic diseases, and make an estimation based on the general population statistics of how many individuals within their firm are affected by those diseases. We then run the numbers based on their employee count and a couple of other variables, and we can show them what the cost would be to them if they wait on implementing a program. And so it just paints a significant picture, a picture of impact for them to better understand why they cannot and should not wait for some form of mandate or requirement to implement a program before they start making considerations for one. Okay, so this is what we do in many of our lunch and learns. We ask everyone to take a moment and stand up and stretch. If you're at a desk, you can stand up and you can raise your hands above your head. You can stretch out towards each wall. You can bend down at your waist and touch your toes. So if everybody can take 5-10 seconds to move around a little bit. We do this because it is one of the most detrimental things that an office worker can experience is sitting at their desk too long. It's bad for your circulation. It's bad for your heart. It can play havoc on your scale. So if everyone can just stand up and move around for a minute. All right. Well, if you want us to keep standing, you can. But if you'd like to, you can sit back down. Also, one of the things that we like to talk about here is eye health. When you are sitting at your desk for hours upon end, there's negative effect from the continuing glare of your screen. So every 15 minutes or so, take a minute, sit back, readjust your eyes so that you're focusing on somewhere other than your computer. Give it about 5, 10, 15 seconds, and then you can refocus back on your computer. But it just gives your eyes a break from the glaring screen. Okay, talking about the true elephant in the room, their healthcare reform. Healthcare reform has a direct impact on workplace wellness. There's several key areas that we want to address today. The first one is the exchange versus privatized insurance. And we get this question a lot of what's the difference with how does sending my employees to the exchange versus keeping insurance private. What is the impact with workplace wellness? Well, the reality is a company can send their employees to the exchange, pay the penalty, and not have a wellness program. It is our belief that in time, the employees that are sent to the exchange are going to be rated based on their existing health. So if their existing conditions, their premiums are going to be higher than someone who is in a more who's healthier or who does not have a pre-existing condition. It is our belief that over time, employees are going to be priced out and can't afford the insurance that they're required to have. And they're going to come back to the company and say, company ABC, we are now in the exchange and we're paying our health care into the exchange, but we're being priced out. We can't afford it. What are you going to do to help me become healthier and lower my rate so that I can afford it? So whether a company keeps their insurance privatized and is obviously motivated to keep the premiums down, keep them down for the privatized insurance, they also are going to be pressured. It is our belief they're going to be pressured even if they send their employees to the exchange to have some form of workplace wellness program. Secondarily, the morale, retention, and sentiment of sending employees to the exchange. In some instances, when we've talked to employees, they've felt like they've kind of been sent off and they're on their own. And creating a workplace wellness program that says we do care about your health. You are getting your insurance from the exchange, but we do care about taking preventative measures to ensure that you stay healthy. It is a great boost to morale, and it also helps with retention. It's been proven that there's significant retention when workplace wellness programs are implemented. There is one concession in the exchange that does directly impact workplace. I'm sorry, there's one detail in the healthcare reform that directly impacts workplace wellness. Before, companies were given up to 20-25%. They were given the ability to rebate 20 to 25% of an employee's premium if the employee participated in a workplace wellness program. That percentage has now increased to 30% so that they now can give up to 30% rebate of the premium that they're paying into for each employee. So an example of this is if a company pays $100 into John Smith, employee of company ABC, if they pay a $100 premium per month into his premium, they now can reward him back up to $30 if he participates in a program. This is a huge incentive because this is pre-tax, so it's a benefit. Both company and employee benefit from this opportunity. This is something that we see companies are not taking advantage of enough, and it's a win-win, and we always highlight and make recommendations that companies look into this in order to incorporate this offering into their rewards and incentives program, piece of the program.
Anyway, I think that was another topic that was discussed quite a bit when we were in the in-person event. A lot of people were trying to figure out, well, what are the policies and restrictions around that? How do we account for that? How does that fit with the rest of our engagement piece? So just wanted to shout out that as you're thinking about programs and how you would implement an effective wellness program within your organization, those are another perfect examples of some of the business questions that have to be answered and decided in policy questions within your organization.
Yeah, thank you for that. So real-life examples, what hasn't worked and what has worked. Going back to Jason's comment about engagement, you can create a pretty picture. You can create a polished, amazing program, and if the employees aren't engaged and aren't interacting and participating, then it might as well be collecting dust on the shelf, and you're not going to see the return on investment that you had hoped for. So I want to give a couple of examples of why the failures have occurred. But giving you the first example of a company where it hasn't worked. There is a large company that implemented a wellness program, and basically what they did is they created a biometric screening and health risk assessment program in which the employees received a printout of all of their medical information, and there were recommendations associated with it. So if they were in a high-risk area, they were told to go to see their doctor, or if they scored well and they were at low risk, then they got a clean bill of health. Beyond that, the company simply put up a couple of posters in the break room. If there was a need to talk to someone about depression or weight loss, they could call a 1-800 number. This went on for about 5 years, and then the company realized that they weren't receiving the return on investment that they wanted, and so they cut the program. I've spoken to a couple of those employees within that company, one of which said that, well, let me step back. The concession that the company said that they would give in canceling out the program was that they would give $200 to $300 to each employee if they would go to their primary physician once a year. The individuals that I spoke with after the program was canceled, one said, I don't even have a primary doctor in here. He's young, he's in his 20s, he's a stereotypical single guy who, because he's relatively healthy, he doesn't need a doctor. he said, I'm not going to take the time out of my day to go find and see a doctor for a physical. He said, I really liked having the biometric screening come to me. Another employee that I talked to, she was a smoker, and she stopped smoking when she knew that her premiums would go up, because if they found that the nicotine in her bloodstream, then her premiums would go up. Since they have canceled out the program, she's gone back to smoking. So that is an example of programs that haven't worked, that need, and having employees within those companies that really do need a program. A real-life example of what has worked is a company that we work with. They're a young, tech-savvy firm. They have a younger demographic. We implemented some of the programming that we normally do, lunch and learn, and a couple of other standard offerings. We realized that it would be much more impactful if we got them engaged in other ways. And they, because they're active, we created a running club that they can run in before work. They are very social, so we started creating healthy happy hours where we brought in healthy appetizers and drink options, so that they could learn how to avoid heavy caloric-laden beers and sugary drinks. The reception on that completely changed the landscape of our wellness program for them. And so the secondary, the one that worked, is proof that you have to understand the culture and the people that are in it. In order to have an effective program, like Jason said, you have to have engagement. You have to understand the culture. You have to understand the employees in it. And even within a population, you might have to tweak the program so that you can accommodate yourself to both white-collar and blue-collar workers. Because, again, it's not one size fits all. All right, last time for everybody to stand up and stretch. Take 5-10 minutes to raise your arms, swing your arms around back and forth, do a jumping jack if you want to, stretch out, kick your legs out. It's just a good way to ensure that circulation is going through your body. Okay. So in closing, what works for one company will not necessarily work for another, as I mentioned just before. And the healthcare reform will impact your need for a wellness program regardless of whether or not your employees are sent to the exchange. It is not a mandate now, but there are several bills that are sitting and floating around Congress that with time we believe will become some form of regulatory requirement for companies to implement a workplace wellness program. And we are encouraging for companies to stay ahead of the curve and to implement the program before it's something that comes down and is required. The health crisis will continue if companies don't begin to take responsibility for encouraging health and wellness within their organizations. It's a great opportunity for them to get in front of their employees and quite frankly show goodwill in that they care about their employees beyond just what they produce during a day's time. And then waiting to implement a program truly will cost you. You will continue to see claims numbers rise, and until there's a program in place, it's very unlikely that those costs will decrease. If you have any information, or if you have any interest in getting more information, please feel free to contact us. There's a variety of ways for you to reach us. You can also follow us on our blog, Facebook, and LinkedIn. We would welcome the opportunity to talk to you further about our offerings. And then, Jason, actually, do you want to talk a little bit about the upcoming event?
Yep, absolutely. Thank you. So in February, we're going to do in-person, again, a webinar that's going to focus on how do you actually develop a wellness program, how do you implement it, and it will look at things from, you've made the decision that you need to do something, but you're not quite sure where to go first and what needs to be included and what to exclude. So Emily and I will be presenting that together in February. In March, we're still finalizing the speaker, and then in April, we're looking to have a speaker who's going to talk some about compliance and governance for your organization, whether it's using social media, internal tools and systems, or complying with other government mandates, which would also apply to any HIPAA issues and release of wellness information as well too. And they'll be coming up in April that we'll be talking about that.
And I wanted to open up to see if there are any questions.
Yep. So at this point, we did have a couple questions come in, and a couple people have sent ideas via the chat window. So if you have anything that you would like to ask Emily or share with the group, please chat it to me, and I'll throw it out there for the group. So we have a handful of questions right now, Emily. The first one is, my company doesn't have any form of program. Where do I even begin?
Okay. From the top down would be my first response. Without C-suite engagement and buy-in, not only from executive management, but also from mid-management, it's going to be very difficult for a company to create and sustain momentum. We find that the programming that is most successful are the companies where their C-suite is actively involved in the program itself, and actually, quite frankly, setting an example for others to follow.
Yep. And a related question that came in is, you mentioned that one size doesn't fit all. How do you determine our specific needs for our company? What sort of assessment should we do to figure out what to include in our program and what to leave out?
Sure. So for back to my comment about the breakdown of your employee base, be it blue collar or white collar, usually there's in a blue collar setting there's typically there's some white collar, but then we also find that some firms they're primarily white collar. The one that has the mix of the white and the blue collar really do pose the greatest challenge, because you have people that are sitting on a truck working all day, and then you have people that are sitting at their desk in front of their computers all day, and then how do you even attempt to connect the two into programming that will work for both? What we found is that there are some fundamental fitness and nutrition principles that apply across the board, and we have found that through our portal and through our app, we are able to.
I'm sorry, because if someone's got a dog behind them, if they can mute your phone, please. It's cutting in.
Okay. We have found that through the combination of the portal and the app, that we're able to be it blue collar or white collar, they're both able to utilize our resources no matter where they are, be it on a truck or in front of a computer.
Yep. And if I can just also share some of the things that we'll be talking about more in the February event is right around this topic. Because another two areas that Emily and I have worked on before is, first, coming also from a business perspective, what is the business case for the wellness within the organization? What are their business goals in a wellness program? And then I know, Emily, that your team does some health risk assessments as well, too, to sort of figure out what are the overall trends or specific problems that are most faced by this organization from a health and wellness perspective, and then using that to figure out specific components of the program.
Yes, absolutely. It's another way that we can categorize the greatest risks and identify subsequently the greatest needs.
Yep. And then two other questions that we have for you. One was, what is the time before you begin to see a return on investment?
Okay. We typically stipulate a year's time. There'll definitely be a huge accomplishment, typically qualitatively, amongst individuals over the course of that year. And there will be other significant marked improvements as well with the population as a whole. But in order to quantify and measure claims cost year over year and measure biometric screening year over year, it doesn't make sense to analyze them prior to 12 months. We're creating a lifestyle modification, a lifestyle change. It's something that first has to be created thanks to a shift in a mindset, and then the behavioral lifestyle changes. And then after that point, you then can start to see the physical changes within one's body. So it really does take a year's time to get basically from point A just to point B and creating a new lifestyle for yourself.
Great. Okay. And then the last question, just to close out, some people have indicated that they're trying to decide if they should go to the healthcare exchange or stay with private insurance. Does Sade help with that, and what should we do?
Yes, we have staff. We have HR consulting on staff where they come in and can assess and help through a very simple matrix, identify what is more, from a cost standpoint, what's more advantageous for a company. In some instances, a company says, I don't care about the numbers. I'm either sending my employee to the exchange or I'm keeping it privatized. Some companies have very rigid beliefs on which way they prefer to go. But there is a matrix that you can run in order to determine whether or not it from a cost perspective it's better to keep it privatized or sent to the exchange. Great.
Okay, that's all the questions that we've had come in so far. So Emily, do you want to just share any closing thoughts, and then we'll wrap up?
Sure, that'd be great. Just to follow up, if you all have any interest in learning more about how to implement an effective program, there are a couple of things that we would recommend. First, consider surveying your population. Again, in order to get the engagement and buy-in that you need to know what motivates your employees, what makes them tick, what would get them up and doing yoga on a Thursday afternoon. The second thing, we offer free lunch and learn. So if you would be interested in having us come in and do a lunch and learn to the general population about the importance of health and well-being, we would be happy to do that. We also would be happy to come in and talk to your C-suite or your senior management for them to start understanding the impact and importance of workplace wellness. And also recommend that you attend our next seminar about developing an actual program, because that's where the fun and creative side comes in for us, is that we are able to assess a company's population and, based on our assessment, identify the best offerings and programming that we feel would be best suited for your current population.
That's great. Super. All right. Well, thank you very much. Thank you, everyone, for joining us today. If there's anything that Emily can do to help you, please don't be shy about reaching out to her group. You should have her contact information. Emily, I don't know if you want to put the screen up with your contact info again one last time.
Sure.
We appreciate everyone joining us, and we look forward to hearing back from you. Please come and join us in February. And if there's anything that Tritons can do to help with you with your employee engagement issues, or helping you roll out new programs, whether it's a wellness program or with IT programs where we focus quite extensively as well too, we're very happy to meet with you, so don't be afraid to contact us either. Okay, hope everyone has a great afternoon, and we'll talk to you later. Thank you.